Good.
All right, so you can go ahead and go to the next slide.
Okay. Sorry about that.
Oh, no, you're fine. All right, so like I said, I work for Levine Cancer Institute. And since the beginning of the Cancer Center, our president, Dr. Raghavan, really had the motto of where you live should not determine how you fight cancer. So bringing the world-class cancer care, quality treatments close to home. And so if you go to the next slide, you can actually see the amount of, or the locations of LCI. And that's just, I'm not sure what you know about cancer treatment, but a lot of patients are coming in regularly, sometimes daily. And this just gives them the opportunity to not spend so much time for themselves and their loved ones on the road. And next. So cancer after COVID, we're going to jump right in. So this is a super important topic, especially still going through, but hopefully coming out of the worst of the COVID-19 pandemic. And that's because our cancer screening rates have decreased. So why, there's public fear, just the increase of caseloads of COVID-19, in local areas have potentially dampened people from going to the doctor. Diagnostic tests were delayed for a period of time. And then in some cases, cancer screening has stopped. We were thankfully able to continue our Project Pink program through, I think we were closed for about 2 months, but then we're able to reopen safely. And so we're very thankful for that. But that's not the case in every area. And so just a reminder of how important it is, even during the pandemic, to get all of your cancer screenings. And so what to think about, a big thing is how long it's been since you were last screened, how common COVID is in your community, and the cases in Mecklenburg County are actually starting to go down, which is amazing. Your age and your overall health, and definitely having that conversation with your doctor. A great way to get in touch with them is through the portals or a quick phone call, if that is something that you are concerned about. But do not put off getting medical care if you have any signs or symptoms that could be from cancer. Screening and early detection literally could save your life. So what is cancer? We're going to kind of start general, and then we'll narrow in a little bit more on breast. So in its most basic form, cancer starts when cells begin to grow out of control. It can start in any part of the body and spread to nearly any part of the body. Breast cancer is specifically cancer that starts in the tissues of the breast. It's most common in women, but that it does happen in men. As Viv mentioned earlier, it is the second leading cause of cancer death in women. And you can see there with the 5-year survival rates, you've probably heard, early detection saves lives, but that is exactly what that means. So there's different stages of cancer. Stage 0 or stage 1 is finding cancer at its earliest, and there's nearly 100% survival rate if we can catch cancer that early, which is why mammography, self-checks, knowing the signs and symptoms, all of those things are so very important. And even a stage 2 has great rates. And so that's what that saying that you hear is early detection saves lives, is because it does, quite literally. So why are we trying to find it early? So the goal of screening mammograms, which we'll learn a little bit the difference between screening and diagnostic, but the goal of a screening is to find cancers before they cause symptoms. So your screening mammogram is your mammogram we recommend every year. And because cancer is found when they're symptomatic or when they cause symptoms tend to be larger and have more likely to spread. Cancers found during screening mammograms are more likely to be smaller and confined to one area. That also means you have more treatment options. You could be treated locally, could be less invasive treatment options, and it also saves your breast tissue. So finding it early all leads to increased chances of survival. We're going to talk a little bit about prevention. And when we're saying the word prevention in this presentation, we're talking about lowering your risk. None of these are sure, like, man, I wish I had the magic ticket where if you did this, that means you do not get breast cancer. We don't have that cure yet, but these are all things that you can do to lower your risk of getting breast cancer. And a risk factor is anything that affects your chance of getting a disease. There are some things we'll talk about that you can change, that you have control over and you have power over. And then, there are unfortunately some things that we can't change, such as our age or the fact that we're male or female. And just so you know, risk factor does not equal disease. So even if you have everything on this list, we want you to pay attention to that. We want you to be aware of that, but that does not mean that you're going to get breast cancer. That just could increase your risk. And we believe that knowledge is power, and so just knowing what to look for. So breast cancer risk factors that you cannot change. Again, we mentioned gender, so it's much more prevalent in women. Aging, we're all aging, whether we like it or not. Genetic risk factors, we can't change our genes. Family history of breast cancer, a personal history of breast cancer, race and ethnicity, your breast density. So we actually have different types of breast tissue in different women that shows up differently you can see that on mammograms. And there's some types that are more likely to develop breast cancer than others. Your menstrual period, so your cycle history can increase your risk of breast cancer, and then any previous radiation to the chest. So gender, we just mentioned that. Being female, unfortunately, is the main risk factor. 100 times more common in women than in men. Women, our lifetime risk is 1 in 8, and for men, it's 1 in 883. So that's a very big difference. Aging, our breast cancer risk increases as we get older. About 1 in 8 are found in women younger than 45, the invasive breast cancer type, and then about 2 of 3 are found over age 55. And so that's why it's really important to get yearly mammograms throughout the span of your life, starting at age 40. And this is just a graph to just outline what we just talked about. It is not that you cannot get breast cancer when you're young. It's just much more likely as you age. So why are older women more at risk? We mentioned the menstrual period. So that's part of it, the age of menopause, a lot of things that, again, you don't have any control over. Just the exposure to reproductive hormones over the course of your life. Your age at your first pregnancy, your number of pregnancies, and then also if you are or have taken any hormone replacement medication after menopause, there are certain medicines that can increase your breast cancer risk, and so those are always great things to talk to your doctor about. Other risk factors included family history. So having a first-degree family member, which is defined as a mother, sister, daughter, can double a woman's risk. But the thing that I like to make sure is so clear, like, yes, that doubles our risk. And so it's something to know about. Again, knowledge is power, but less than 15% of women actually have a family history. 15% of women with breast cancer. So a lot of times in the community, when we're doing education, patients might say, well, nobody in my family has it, so I'm fine. I don't, but that is not the case. Less than 15% of women with breast cancer have a family history. So it's super important, regardless of family history, that you're still doing self-checks and getting your yearly mammograms. Other women who are also at higher risk, and you might have heard of the BRCA1 or the BRCA2 gene, and this slide just talks a little bit more about that. And those patients are at a higher risk of breast cancer, and that's due to a gene that we're able to see if you've had genetic testing. It increases your breast cancer risk over your lifetime to about 20 or 25. And once you know about that information, then you can talk with your doctor. You can have more of a game plan or a personalized treatment on what you want to do with that information once you find that out. So the good news, the encouraging part of the presentation is there's also a lot of things that we can change, and there's a lot of things we do have control over when it comes to lowering our risk. So that is having children, birth control, choosing not to use hormone therapy after menopause, breastfeeding, drinking alcohol, your weight, and physical activity. So for all women, this is straight from the American Cancer Society. So both increased body weight and weight gain as an adult are linked with a higher risk of breast cancer. So just the basic recommendation of staying at a healthy weight and trying to avoid excess weight gain. And also in alcohol, they recommend 1 drink per day, and they define a drink as 12 ounces of beer, 5 ounces of wine, or basically 1 shot. And low levels of alcohol intake have been linked with an increase in risk. So just making sure you're aware of that and can make decisions accordingly. And being physically active, which ties into being a healthy weight, but American Cancer Society recommends 150 to 300 of moderate or 75 to 150 of vigorous. Moderate is like a brisk walking pace, whereas vigorous is going to be a higher heart rate, maybe not as conversational. And that's over the course of the week. And they say getting to or exceeding the upper limit of 300 minutes is ideal. We have another program called Fit for Life, and it also talks a lot about being physically active. And we really encourage women, and anyone to start where they are. So that doesn't mean tomorrow that maybe you wake up and do those HIT classes, the, high intensity training, but maybe you park further away in the parking lot, or you take the steps, or you go for a walk with your friend or your partner. And so just trying to increase your physical activity in small steps where you can, to build habits and routines over time. Other factors that can lower risk is women who choose to breastfeed. They get an added benefit of reducing their breast cancer risk. And then again, to avoid taking the hormone therapy after menopause, and talking to your provider about non-hormonal options there. We talked about healthy weight, and we talked about exercise and alcohol. So, but is there a link between diet and breast cancer? We hear that anytime you Google it, all in the news. And the answer is it's unclear. We know that eating more whole foods, fruits, vegetables, limiting processed foods and sugar is going to make us feel better and our bodies function better overall, but it's not clearly like how directly it's tied to actually breast cancer risk. And so, our nutritionist at LCI, recommends that. Like, we know overall these things are going to make you feel better, which is going to then help with your, daily functions, which is going to help with exercise, which is going to help with being at a healthy weight. If you're doing this during treatment, it's going to help you feel better overall. So some studies have suggested, again, high vegetables, fruit, calcium rich, low in red meat, processed meats. And then there's not a lot of direct correlation in fat, basically lowering your fat intake. But then it says a diet low in fat, processed and red meat. So those are kind of let's limit those. And sugar, and then high in fruits and vegetables have many health benefits. And so that's including a lot of the other types of cancers as well. So breast cancer screening. So we've got 3 steps to remember when we're thinking about breast cancer screening. So the first one is going to be annual clinical breast exam by a doctor or nurse, and then a mammogram every year after 40, and then your monthly breast self-exam. So your breast self-exam, that is recommended starting, basically once you have breasts, maybe once you've started your period. We definitely promote breast self-awareness, just that you know what's going on with your body, because you are going to know when something's wrong or not acting accordingly. If you're looking for a timeline, we recommend you check your breast 7 days after your period. If you don't have a period, we just recommend you put it in the 20th and say every month on the 20th, put a reminder in your calendar, and that's when you're going to do it. We recommend that you examine your breast 3 different ways. In the mirror, lying down in shower, and we'll get into that in a little more detail. That you would examine them using the pads of your index, middle, and ring fingers. So that's these 3 fingers here, kind of like Scout's honor. And then most lumps are actually discovered by women themselves through the monthly breast self-exam. I'll also like to make sure it's super clear, though, that 8 out of 10 lumps are non-cancerous. So yes, our goal of these monthly breast exams is to look for symptoms, but just because you have a symptom does not mean you have cancer. There are a lot of other things that it could be. It's also just things called non-cancerous lumps or cysts. But the thing is, we just want to be aware, and if it would be cancer, we would want to make sure we have found it as early as possible. So the lump that you're looking for, usually a single, firm, most of the time painless. Other signs and symptoms is an inverted nipple, so your nipple actually turning in. Nipple discharge, so anything leaking out of your nipple. Skin swelling or dimpling. Or that skin surface may be red or veins more noticeable. Those are all things you're looking for as you do your breast self-exam. So you're going to begin by standing, again, we recommend out of the shower because you're already naked and it's easier to do it that way instead of having to go through this can be part of your routine. And so basically you're just going to stand with your hands on your hips in the mirror, and you're just going to take a look at your breast, making sure that they're their usual shape, size, and color, that they're evenly shaped for you without visible distortion or swelling. So again, it's what is normal for you is what you're looking for. That's the baseline you're looking for. If you see any of the following changes, bring them to your doctor's attention. And then step 2 would be to raise your arms and look for the same changes. So you're going to be able to see a little bit different of an angle there. And then while you're also looking at the mirror, look for any signs of fluid coming out of one or both of your nipples. And then you're going to feel your breast while laying down. And that's when we're talking about that 3 finger. And there's some examples there of patterns. And so basically you can choose whichever pattern works best for you. But it's just making sure that you're going to cover the whole breast. And so we recommend that there's a little bit of a method to the madness there. So again, you're doing the 3 fingers. You can either do up and down, circular, wedge, whatever kind of works best for your mental space. And then lastly, so that's all happening. So you've stood up in front of the mirror, raised your arms in front of the mirror, you've laid down, you've done the actual breast self-exam with the three fingers. And then also while you're standing or sitting. And this is where it's easy to do that in the shower, just because it's an easy reminder to do. And then people say it's easier to do when your skin is wet and slippery. So you're going to do the same motion or the same circular pattern with the 3 fingers to cover the whole breast, again, while you're sitting or laying down. And that's because we all know this, when we sit, lay down, our breasts move. And so that's just, it can allow for us to find or feel things that we wouldn't in another position. And that's why we ask you to do so in different positions. So then the next one is mammogram every year after age 40. So mammograms are by far our best screening, 100%, but it's not perfect. 1 of 10 cancers do not show up on a mammogram, which is why it's important to also have the annual CBE, which we'll talk about, and then to practice breast self-awareness. Younger women do tend to have dense breasts, which makes mammograms a little harder to read. And older women have fattier tissue, so their mammograms are easier to read. Mammograms find lumps that cannot be felt, which is the amazing thing. And, sometimes there's some concern about radiation, but you actually receive more radiation flying on an airplane than receiving your annual mammogram. A low-dose X-ray captures the image of the internal structure, so it takes 2 different pictures. And these are the science has come a long way in the past. There's actually what we call tomosynthesis, or a 3D image, and so it's much higher quality images compared to what we used to take. And that's just a picture of an example of what a mammogram machine looks like if you haven't had one before. And so there's 2 different types of mammograms. So our screening mammogram, that's what we recommend again every year. That's for patients who are not having symptoms. And that's the 2 images that would be taken on the X-ray machine. The diagnostic mammogram is a very similar experience. And this is for women who have either had breast cancer recently or who have symptoms. And that's because the radiologist or the doctor would then request for the images to be kind of concentrated on either the area of concern. So if you found a lump on the left side of your left breast, they may take 10 images just of that area to get a very clear picture of what's going on. The experience for the patient is going to be very similar. It's just the amount of pictures that they take is going to increase a good bit. So if you've went to schedule your mammogram recently, they do recommend at least 6 to 10 weeks, but at least 4 post-vaccination, just because when they do take those X-ray images, there have been some cases where the swelling from the vaccine, the immune response, may cause your lymph nodes to look like it's something of concern when it's not. And so just to not cause any anxiety or any additional screenings or procedures that don't need to happen, the National Breast Cancer Association has recommended at least 4, but ideally 6 to 10 after your vaccine. So talking with your doctor about, if you're due for them both at the same time, what's the priority? Is the priority to get the vaccine, or is your priority to get your mammogram, and then schedule that accordingly? If you choose to get your mammogram tomorrow, you can then immediately get your vaccine. But if you get your vaccine first, again, that's for that delayed timeline. And that could be something to think about as boosters are becoming available. And then the third step is the annual, what we call CBE, or clinical breast exam. And it's conducted by a medical clinician. For women in their 20s and 30s, it's recommended that it be part of your regular health exam. It says at least every 3, but our docs, really prefer it every year. And I asked my OBGYN or my PCP to include it with my yearly pap smear. And then for women 40 and older, it can be a good complement since a small percentage of tumors are missed by mammography. So again, it's just making sure we have those 3 things in conjunction will give us the best chance to find breast cancer early. And we recommend that you talk to your doctor. Again, knowledge is power. And so not only for mammograms, but for other cancer screenings that might be coming up for you, depending on your age. So just asking your doctor, what screening tests are right for me? What can I expect from them? So you can prepare. What does follow-up look like? Are the results instant? Does it take a couple of weeks? What happens if they find something? Does your doctor office offer the screening, or does a referral need to be placed? And if I have questions, who can I talk to? So those are all great kind of questions to go in with if you're going into your annual, or to, like we talked about, messaging your doctor through one of the online systems. And if needed, I sometimes for, heavier appointments, I like to take my husband. I always tell my mom to go with my dad, because, if you are getting the results, or if you are talking about something, or you have any, medical anxiety, it's really good to have someone else there with you who can help listen and take in and hear what the doctor has to say. So that's always an option. You can ask for information to be written down or repeated, or again sent to you via the online portal, just so that you can go back and remind yourself what they said about follow-up or results, or anything like that. And then don't be fearful of requesting a second opinion, and trusting your instincts. Again, knowing your body and knowing when something isn't right and needs some further action. So great thing about mammograms is if you are 40 or older, and most insurances cover them for free. So that's part of the annual preventative that they cover. You can call either Charlotte Radiology, which is who we work with. You can call them directly. Or Levine also has a mammography program depending on your insurance coverage. If you don't have insurance, we do have programs like Project Pink. We're actually coming to the library in March. And so that's for women who don't have insurance, who live in Mecklenburg County, again, who are 40 years and older, and who aren't experiencing those symptoms. We'd love to, connect with you and get you scheduled for a free mammogram. And if you're not in Mecklenburg County, you can also reach out to me. We have kind of a resource list of surrounding counties we'd be happy to connect you with. All my information came from either the American Cancer Society or the American Institute for Cancer Research today. And there is my telephone number and my email. So again, if you have any questions, if anyone's watching the recorded version of this and would like to learn more about Project Pink or just next steps, please don't hesitate to give me a call. And that's it.
Much information. Oh my, this was terrific.
Great.
Terrific. I definitely appreciate how you broke down the process, because a lot of people, interestingly enough, they go to the doctor and say, oh, everything's okay. They don't share that they might have a concern about the shape of their breast, or maybe they have a lump. And like you said, a lot of lumps could be fatty tissue or some type of other non-cancerous mass. And it's good to know, because I've experienced myself where I've noticed something and it wasn't thank God it wasn't what I thought it was. And the doctor did a diagnostic.
Yeah, that's right.
Between the screening. And yes, you just told me that was so eye-opening, because I said, okay, what's the difference between screening and a diagnostic? And more pictures were taken. And, they said, okay, you turn this way, turn that way, and the camera kept rotating in different spots, but specifically for something that was more of concern. So I wrote that down. I did have another question that, what are the stages of breast cancer? Like someone says, oh, I have stage 1 or I have stage 2. What is that communication about? I never really understood.
Yes, and I am not medical, but in general, what we're talking about is the progression of the cancer, or how invasive. So a stage 1 or stage 0, stage 1 is going to be localized. So that means it's less likely to have been spread to other parts of the body, been in the lymphatic system, because you can hear about breast cancer that starts in the breast. So it's always called breast cancer. It starts in the breast, and then people use the word metastasize to other parts of the body. And so if it is spread, that means we're more likely catching it at a stage 3 or a stage 4. And so it talks, so that staging is a medical terminology, but in general can provide some information on how small and localized versus how aggressive and how far it's spread, kind of on that spectrum.
Yeah, because I've heard of metastatic breast cancer, and of course we know that is severe. It's spread beyond the breast, ducts, and then a lot of people are concerned about well, if you do get to the stage like 3 and 4, is there a way to cure without the sadness of death? Because we know some people are victorious and that
Yes,
have
yes.
overcome it, but how do they go about like surviving this?
That is a great question. So stage 3 and 4 is by no means, again, science has come so far in the last, oh my gosh, 10, 15/5 years even in treatment. And so that is still the great thing about living in today's age with the science that we have, is even if we get a stage 4 diagnosis, that does not mean a death sentence anymore, which is huge. It just means the treatment's likely going to be harder. It's going to require like a stage 1 or a 0 may require one of the 3 treatments, being chemo, radiation, or surgery. Whereas a stage 3 or 4, where the doctors are likely going to attack it from different ways, which is just going to be a harder experience on the patient because your body is going to be subject to radiation, chemo, and surgery.
And you mentioned genetic breast cancer, like if your grandmother or aunts or mom have breast cancer, a lot of women go to the extreme and they feel like, well, if they had it, I might have it, and then they get their breasts removed. What are some ways to, I guess think about breast cancer differently? Is it just genetic? Like, is it more like you could be the first in your family to have it?
Oh, for sure. So that's why I really like to say risk factor does not equal disease, right? You know, we're talking in ifs and ands and buts here. You could have a 90% chance, which is, I mean, crazy unlikely that I'm making that up. But, you know, let's say you have a 90% chance of getting breast cancer, you could not get it. Like, that's just your risk. And when we're talking about risk here, like a family history may double it. That's going to double it to maybe 15 or 20%. And there's still a very large percentage that you may not get it. It just, basically it's telling the doctor and telling yourself like how important the mammograms, your communication, your awareness of your body is, because you are at a higher risk, but by no means is it saying, oh, my mom had it, so I definitely have it. And the biggest thing there is 85% of women do not have a family history. So it is a random, like that first slide where cells start to grow out of control. It is a random thing that happens in our bodies. And that's
why it was so good you mentioned taking care of yourself. That's where it starts from. Obesity had a lot to do with the concentration of this cancer. And then a sedentary life, you know, if you're not active out walking or doing just chair exercises, I mean, something simple as that. And then heavy drinking, because, you know, you booze it up and you can lose it up, you know. It's more than just drunk driving, it's drunk driving your body, you know, you have these extra things against you and your body's trying to fight it off. But, you know, if those cancer cells are there, they're awakened by the type of lifestyle. So I'm glad you mentioned that. I was wondering, anyone else in the in our audience today have a question or want to share an experience? Well, I know when I would say clarifying when you go to the mammogram, to get a mammogram. A lot of women think because you have larger breasts, that might be more reason to check. Does size matter in this case? Like,
size does not matter. Breast tissue, again, that matters, but that's not something you're going to know until you go get a mammogram. And there's nothing that we can do about it. It's just the type of tissue that we have. But size from a, you know, not from a healthy perspective, does not increase your risk one way or the other.
Yeah, because I think the misconception is that if a woman is heavy chested or has a larger breast, they might have more of a chance to get that.
Mm-mm.
It has nothing to do with that, because
Mm-mm.
small-breasted woman or man in that case
Mhm.
also
Yep.
have.
And it can make your, breast self-exams a little more difficult if you are large chested, just because you're not able to feel all the way down, which can increase why a mammogram is so extra important. But there's nothing directly correlated to breast size.
Another question, I noticed that in some cultural backgrounds, there seems to be more of breast cancer, specifically Black women. Have you noticed that? Is this because of diet, or is like, what is that factor? Is there
That's a great question.
some type of racial breakdown that shows that people that are Black or African American have higher risk?
And that is something that LCI has looked at. A lot of research has tried to pinpoint exactly what it is, and it's similar to the link between diet and breast cancer. Is it's unknown. We know the data, we see the data, but there's not a because we can't say that everyone who has breast cancer eats unhealthy or has an unhealthy lifestyle, or some of the things we do know is those things we just mentioned, an education standpoint or awareness, access to care, being trusted by your doctors when you're telling them something is wrong. Those are all factors, but there's not just one thing that I can say this is why. Again, not having insurance. So like there is a lot of work being done to try to educate and bring access to about all of those. But unfortunately, we don't have the exact answer there.
That's why we conduct Project Pink for women who do not have insurance, of people that might be underserved, because some communities do not have access to a clinic or even a hospital. Some areas you have to drive a distance or take to get to a hospital, and taking off of work also to go to a lot of screenings or diagnostics, because as we know, some of us are working class, and you have to take off of work. And then those of us who are not at work, they might have children, so you can't actually, yes, you can take your, spouse or friend with you, but your kids in that.
Right. I mean, those are all, yes, very, very valid points.
Yeah. And you know what? A lot of people think that it's just about the women with breasts. Men have breasts too. I know I looked at a report from the American Cancer Society. Says breast cancer also occurs in men, but is very rare. Male breast cancer accounts for 1% of all diagnoses. Approximately 2,650 American men will be diagnosed with breast cancer in 2021, according to the American Cancer Society. So have you seen like a participation in mammograms like with men?
So that is where, again, men are not recommended for annual screenings because it is so rare. But we do perform diagnostic mammograms through our program on men. So those are just like a woman, people who have presented to their doctor with a lump, pain, nipple discharge. And that's the same way that we would evaluate their breast, would be through that diagnostic mammogram with the ultrasound. And we have through the program diagnosed men with breast cancer. Like it is rare, but it is definitely a thing. And so if you have men in your life, and they're mentioning something like that, like we want them to get that checked out, just as we would encourage you to do that. Exactly.
And do women who are breastfeeding, they have to have concern about this? Like, I know when a woman is breastfeeding, their lymph nodes and everything is a bit swollen. Like, how do they do their breast exams?
So if you are actively breastfeeding, we don't recommend annual mammograms until post-pregnancy and breastfeeding. At that point, in most cases, you are being followed by your OBGYN. And so if something were to come up that is a problem, you would discuss that with them. And that is where we would use an ultrasound to monitor the breast to see if anything's going on, like while you're pregnant, or like I said, breastfeeding. And we would go about that a different way. But again, no annual mammograms during pregnancy or breastfeeding, and then making sure if something does come up that you're talking with your provider about that. There are ways to safely look into that.
That's awesome. Well, we're coming close to the end of our session today. If there are any other questions, please reach out to Sarah Head. Her is on the screen. I really appreciate all of the vital information you shared with us, because I definitely learned a lot, and I know our guest did. This is going to be a very useful resource that
awesome.
Library will be connected with. I hope we can continue to have these connections with our healthcare in this area in Charlotte Mecklenburg.
Me too. We'd love to come back and talk about all the cancers anytime.
I know, because there are so many, and the sad thing, there are people experiencing these and they don't know where to turn to. We love the fact that Atrium has been a part of this educational development for communities, because it is very necessary. Thank you so much, Sarah, for joining us today. And if you need any more information, her information is on the screen, and also look at Charlotte Mecklenburg Library.org, that's cmlibrary.org, for more programs, because we are zooming in.
Yeah, we are. Yeah, you are.
We are zooming in, and we're open. The libraries are open, but we are offering some great programs online. So please check us out. I really appreciate it. Yeah.
Awesome. Well, it's great to chat with you today, and I'll be looking forward to some questions in my email from you guys.
Yes, definitely. We will definitely have programs, and like you mentioned, the mobile unit will be here in March, on March 10th, and that is exciting.
That is exciting.
Yeah. So
it's exciting.
Yeah, I appreciate you. Thank you so much.
All right. Well, have a great afternoon.
Thank you, you too.